The hallmark symptoms of rheumatoid arthritis, RA, including sore and swollen joints, can leave you reaching for non-steroidal anti-inflammatory drugs, NSAIDs, such as aspirin and ibuprofen to help relieve discomfort. It's important to realize, however, that just because these medications are available over the counter doesn't mean they're completely harmless, or that they're the right choice for everyone with RA. How NSAIDs work for RA. NSAIDs help relieve RA pain and reduce inflammation, swelling, and fever. They work by decreasing the amount of prostaglandins in the body. Prostaglandins, which are produced by the enzymes COX-1 and COX-2, cause inflammation. Depending on the NSAID you take, it may block both COX enzymes or just COX-2. Proper RA treatment usually involves more than just NSAIDs, however. While these inexpensive drugs can help relieve RA pain, they don't actually slow the progression of the disease. Treatment guidelines created by the American College of Rheumatology, ACR, emphasize the use of biologic and non-biologic medications to help slow disease progression, even early in the course of RA. Therefore, it's important to talk to your doctor about other treatment options like disease-modifying anti-rheumatic drugs, DMARDs, or biologics, along with NSAIDs. Also, while NSAIDs can be purchased over the counter for minor pain relief, your doctor can prescribe stronger dosages. These might be more effective for the controlling pain related to the inflammation associated with RA, according to the ACR. The risks of NSAIDs for RA. Though NSAIDs can be helpful in treating RA pain, they come with some risks. Side effects can range from stomach issues, like ulcers and bleeding, to high blood pressure and fluid retention, especially in the extremities. You could also experience kidney problems, heart issues, and rashes. A review of side effects published in November 2016 in the New England Journal of Medicine highlights the importance of discussing your risk for these issues with your physician as you decide which type of NSAID to try. You'll want to carefully consider the amount of NSAIDs you take, too. There's no question that the risk of taking NSAIDs is dose-related, says Theodore Fields, MD, Clinical Director of the Early Arthritis Initiative at the Inflammatory Arthritis Center of the Hospital for Special Surgery and a professor of clinical medicine at Weill Cornell Medical College in New York City. The more you take and the longer you take it, the greater the risk, Dr. Fields warns. Finally, when taking NSAIDs for RA, the ACR stresses the importance of preventing drug interactions. For starters, make sure to avoid using two different NSAIDs at the same time. Also, be sure to discuss all other medications and supplements you take with your doctor. Of particular concern are blood thinners and corticosteroids, but it's a good idea to evaluate everything with your doctor before beginning prolonged use of NSAIDs. Can anyone take NSAIDs for RA? NSAIDs are generally safe for treating pain with RA, but they're not right for everyone. People with heart failure, significant fluid retention problems, significant coronary disease, and active ulcers or significant kidney problems should be extremely cautious with NSAIDs, Fields says. More often than not, they shouldn't take NSAIDs at all, or, if they do, always take them under the close guidance of their doctor. Anyone with these conditions, as well as women who are pregnant or planning to get pregnant, should consult their doctor before taking any over-the-counter NSAIDs for RA, according to the ACR. It's also important to know that there can be an element of trial and error when starting NSAID treatment because people respond in a variety of ways to different NSAIDs. If one isn't working for you, another may provide better results. Fields recommends giving each NSAID at least 2 weeks to build up in your bloodstream in order to know whether it's relieving pain sufficiently for you. As with any RA treatment, be sure to talk to your doctor if you're experiencing any negative side effects or new symptoms so that your treatment plan can be adjusted accordingly. Additional reporting by Madeline Van, MPH.